Approximately 88 million adults in the United States have prediabetes, yet more than 84% are unaware of their condition. It is a critical health condition that often goes unnoticed, but can have significant implications. Defined by higher than normal blood sugar levels, prediabetes is a precursor to type 2 diabetes and increases the risk of developing cardiovascular disease and other chronic conditions. Globally, its prevalence is steadily rising, with an estimated 374 million people affected worldwide. As a silent epidemic, it demands attention and proactive intervention to prevent the progression to type 2 diabetes and its associated complications. By raising awareness, implementing early screening programs, and promoting lifestyle modifications, we can mitigate the impact of prediabetes and improve health outcomes for millions of individuals. It is a condition characterized by elevated blood sugar levels that are higher than normal but not yet high enough to be diagnosed as type 2 diabetes. Understanding the criteria, risk factors, and underlying mechanisms of prediabetes is crucial for early detection and intervention. Prediabetes is diagnosed based on blood glucose levels that fall between normal and diabetic ranges. More on that later in the video. Several factors increase the risk of developing prediabetes, including obesity, sedentary lifestyle, family history of diabetes, and certain ethnicities such as African American, Hispanic, and Native American populations. Prediabetes occurs when the body becomes resistant to the action of insulin, or when the pancreas cannot produce enough insulin to compensate for insulin resistance. This results in impaired glucose regulation and elevated blood sugar levels. Make sure to check out the links in the description for our most popular recommendations for detoxing, lowering blood sugar levels, improving memory, brain health, fast natural weight loss, and more. By understanding the criteria for diagnosis, identifying risk factors, and elucidating the underlying mechanisms, healthcare professionals can implement targeted interventions to prevent or delay the onset of type 2 diabetes and its associated complications. Prediabetes has reached epidemic proportions globally, representing a significant public health challenge. Understanding the prevalence and epidemiology is essential for implementing effective prevention and management strategies. Additionally, more than 80% of people with prediabetes live in low and middle-income countries, highlighting the global burden of the condition. Over the past few decades, the prevalence of prediabetes has been steadily increasing due to factors such as sedentary lifestyles, unhealthy dietary habits, and rising obesity rates. Data indicates that in the United States alone, the prevalence of prediabetes has nearly tripled in the past 20 years, affecting nearly 1 in 3 adults. Prediabetes is not merely a benign condition. It carries significant health risks and complications if left untreated. Understanding these risks is crucial for motivating individuals to take proactive steps toward prevention and management. According to the American Diabetes Association, ADA, up to 70% of individuals with prediabetes will eventually develop type 2 diabetes. This underscores the importance of early detection and intervention to prevent the onset of full-blown diabetes. Prediabetes is associated with an elevated risk of cardiovascular disease, including heart attack, stroke, and peripheral artery disease. Please subscribe to support the channel and leave a comment saying, "I subscribed," and I'll personally reply to your comment. Research published in Circulation and the Journal of the American College of Cardiology demonstrates the link between prediabetes and cardiovascular morbidity and mortality. Additionally, it increases the risk of other health complications such as kidney disease, nerve damage, neuropathy, and eye disorders, retinopathy. Beyond the physical health risks, prediabetes can also impact an individual's quality of life and psychological well-being. The stress and anxiety associated with managing a chronic health condition like prediabetes can take a toll on mental health and overall life satisfaction. Studies from Diabetes Care and the Journal of Psychosomatic Research highlight the psychosocial impact of prediabetes and the importance of holistic care. By recognizing the multifaceted health risks, individuals can be empowered to take proactive steps toward prevention through lifestyle modifications, regular screening, and early intervention. Several tests are used to diagnose prediabetes, including fasting plasma glucose, FPG, oral glucose tolerance test, OGTT, and hemoglobin A1C, HbA1c testing. The FPG test measures blood glucose levels after an overnight fast, with levels between 100 to 125 mg/dL indicating prediabetes. The OGTT involves measuring blood glucose levels after consuming a glucose-rich beverage, while the HbA1c test measures average blood glucose levels over the past 2 to 3 months. Lifestyle interventions, including dietary changes, increased physical activity, and weight management, are the cornerstone of management. Research from the Diabetes Prevention Program DPP trial demonstrates that modest weight loss, 5 to 7% of body weight, and regular physical activity, at least 150 minutes per week, can reduce the risk of developing type 2 diabetes by up to 58% in individuals with prediabetes. Dietary approaches such as the Mediterranean diet, low carbohydrate diet, and natural supplements have also been shown to improve glycemic control and reduce the risk of progression to diabetes. There is a link to the Mediterranean diet at the end of this video. Medications such as metformin, a biguanide anti-diabetic agent, have been shown to reduce the risk of diabetes by approximately 31% in individuals with prediabetes. Behavioral interventions, such as group-based lifestyle counseling and health coaching, can provide additional support and motivation for individuals to adopt and maintain healthy behaviors. Before the last section, make sure to check out the links in description for detoxing, lowering blood sugar levels, improving memory, brain health, boosting energy levels, fast natural weight loss, and more. Programs such as the National Diabetes Prevention Program, DPP, offer evidence-based lifestyle change programs designed to help individuals with prediabetes make sustainable lifestyle modifications and achieve long-term success in diabetes prevention. By implementing a combination of lifestyle modifications, clean diet, natural supplements, and behavioral support programs, individuals can effectively manage their condition and reduce their risk of developing type 2 diabetes and its associated complications. Beat prediabetes with the Mediterranean diet. Watch the video above.